The surge of the COVID-19 Delta variant around the country has raised questions, especially about the vaccine. Here's ABC 10's Thomas Fournier with input from a local expert.
COVID-19 has affected many aspects of life in the Upper Peninsula over the past year. The Western Upper Peninsula Health Department is looking back at that experience in an effort to look forward. Dr. Robert Van Howe says in comparison with other U.S. regions, the UP was late to the party.
Each of the outbreaks, the average age for those being infected dropped. So one of the things that was helpful in the spring outbreak is that a lot of our people that were 65 and older had been vaccinated. And they had vaccinated at a pretty high percentage. Now we're seeing it kind of dropped off in June, and now we're seeing an uptick again. Nearly all the cases that we're seeing are people that haven't been vaccinated.
Vaccine development for other coronavirus strains, such as the 1990s SARS virus and 2000's MERS virus, went into the creation of the Pfizer and Moderna COVID-19 vaccines. These vaccines help the human body to make the proteins necessary to fight off infection, Van Howe said.
This one works by sending in the code for making the proteins of the virus and having our own cells make those. You send in the code for the cells in the human body to make a pure protein, so you don't get extraneous stuff in there that you don't need and then cause more side effects.
Dr. Van Howe also clarified why breakthrough cases are being found and what qualifies as a breakthrough case.
A lot of them are people who, they're going to have a procedure at the hospital, and the hospitals are testing everybody before they have a procedure, and they end up being positive. They don't have any symptoms, but they have some form of COVID in their nose, and they're considered a breakthrough case. And some of them have symptoms. A handful of them need to be hospitalized because no vaccine is 100% effective. But if you've been vaccinated and you become positive for COVID, your chance of being hospitalized is much, much lower than if you just get COVID and you've never been vaccinated.
The number of breakthrough cases in other parts of the country has caused concern for people on the fence about getting vaccinated. But Van Howe said rates are nuanced and depend on a number of variables.
If COVID's not going through your community, you're not going to see any breakthrough cases. If you're seeing a high concentration of active new infections in your community, you're going to see more breakthrough cases just because it's going to be more exposure to the virus. The other thing that happens if you have a high vaccination rate, let's say 90% of your people are vaccinated, and all of a sudden you're seeing that half of your new cases are in the vaccinated, that's still a much higher proportion of people that aren't vaccinated getting the infection. I think those two factors are the major driving thing of how many breakthroughs you're seeing.
The most recent WUPHD report shows the 5-county region has seen 103 cases and 1 death in the last week. The vaccination rate across the area hovers just above 50%. Van Howe and the health department say that not enough has been done to fully protect our community. The department will continue to err on the side of caution in anticipation for the fall's potential infection rates. This has been Thomas Fournier with ABC 10 and CW5.